Okay. This week's examination video is on blood vessels and the abdomen. All right. For blood vessels, step 1 is to palpate the arterial pulses in the distal extremities, comparing the sides and characteristics bilaterally for rate, rhythm, contour, and amplitude. So you'll want to check the ulnar, radial. You want to check the carotids, femoral, the popliteal, the dorsalis pedis, and posterior tibial. Um, you will rate them on a scale of 0 to 4, and 2 is normal. And if you don't feel the pulse in the most distal area, you'll go more proximal until it's palpable. And you can check for capillary refill in the fingertips and the toenails. Next, you will auscultate the carotid, abdominal, aorta, renal, iliac, and femoral arteries for bruits and venous hum. Next, you will measure the blood pressure in both of the arms. You want to do that seated and then standing. So, blood pressure cuff, measure. That's good. Next, you can do jugular venous pressure. You will have the patient start in a supine position and then elevate the head of the bed to a 45-degree angle, and with 2 rulers, you will have one at the line, the nipple line, and the other at the pulsations of the jugular vein, and you will put the 2 rulers perpendicular, and you will measure the vertical distance above the heart, which should be less than 9 centimeters. You want to inspect for the pulsations, any distension, and differentiate between the jugular and carotid pulse waves. Next, you will inspect the extremities for sufficiency of the arteries and veins. So you're going to look at the extremities for color, skin texture, nail changes, the presence of hair, muscular atrophy, and edema and swelling, and varicose veins. The edema is on a 1 to 4 scale. So 1 + 1 would be 2 millimeters of induration if they have swelling that you can make an induration in. I'm not doing very good this week. 2 + 2 is 4 millimeters, +3 is 6 millimeters, and +4 is 8 millimeters. Next, you will palpate the extremities, and you're going to feel the extremities for warmth. You're going to feel for the pulse quality, tenderness along any veins, and pitting edema. Then you can assess for peripheral artery disease by the 5 Ps, which are pallor, pain, pulselessness, paresthesias, and paralysis. You can also do the hepatojugular reflex, where we're looking at the JVP. You can put pressure in the middle of their mid-epigastric region, and you should see that jugular venous pressure, the pulsations. You can see a change where it will rise and then go back down. Pulse abnormalities include pulsus alternans, pulsus bisferians, bigeminal pulse, large bounding pulse, paradoxic pulse, and water hammer pulse. Other abnormalities on your assessment include temporal arteritis or giant cell arteritis, arterial aneurysm, arteriovenous fistula, peripheral arterial disease, Raynaud's phenomenon, arterial embolic disease, venous thrombosis, and hypertension. JVP disorders include tricuspid regurgitation, atrial fibrillation, cardiac tamponade, and constrictive pericarditis. Children may have coarctation of the aorta or Kawasaki's disease. Pregnant women can have preeclampsia or eclampsia, and older adults can have venous ulcers. Now we're going to inspect the abdomen, and for the most part, the patient will be lying supine in a bed. First, you want to inspect, and you want to inspect before you auscultate so that you don't you want to inspect and auscultate before you palpate so you don't affect or change what you would hear. The inspection, you want to be on the patient's right side and with a tangential lighting, and you want to look at the skin characteristics. Look at the venous return patterns where you will flatten out a vein and determine which direction the venous filling is. Look at symmetry and any surface motion and contour. When the patient's lying supine, you will have the patient sit up and look at the abdominal muscles to detect any masses, hernias, or separation of the muscles. Next, you want to auscultate for bowel sounds using the diaphragm of your stethoscope. You want to listen in all 4 quadrants. You want to listen for up to 5 minutes before determining if there are absent bowel sounds. And then you want to switch the stethoscope over to the bell, if you have one, and auscultate for bruits over the aorta, right and left renal arteries, vena cava, right and left iliac arteries, and the femoral arteries, which we did in the last assessment. Next, you will percuss the abdomen. You want to do indirect percussion in all areas of the abdomen. Then you want to listen for tone in all 4 quadrants. Should be an overall tympany with dullness over organs and masses. Then you want to do the liver borders to estimate the span. You're going to go down the mid-sternal and mid-clavicular line and listen for the changes. And with a ruler, you can mark and measure the size. It should be 6 to 12 centimeters. Then you can percuss the splenic dullness in the left mid-axillary line between the 6th and 10th rib. There should be some slight splenic dullness. And you can auscultate in the left epigastric or percuss in the left epigastric and left lower rib cage for any gastric air bubble. Next, you will lightly palpate for muscular resistance, tenderness, masses. Then you will do the moderate palpation and then deep palpation. When you do the deep palpation, you want to palpate for any bulges and masses around the umbilicus and umbilical ring. Deeply palpate the liver borders and the right costal margin. Here you can palpate under the margin, and you can do from the front and back. Palpate the gallbladder below the liver margin. Then palpate at the lateral border of the rectus muscle. Palpate the spleen in the left costal margin. Palpate the right and left kidneys, and palpate for aortic pulsation in the midline, and any other masses. You can also check for kidney tenderness. Turn your back to the. On each side, you can do indirect, whatever you call that, and they can tell you if it's tender at the costovertebral angles. You can also do a CITES assessment, which would be checking for a fluid wave or shifting dullness, and make sure to do a pain assessment. Okay, to demonstrate the percussion for shifting level of dullness, you'll have the patient lying supine, and you will do your percussion for the dullness and tympanic areas. Then you'll have the patient turn to one side and percuss again for the tympanic and dull areas, and note if there's any shifting to the dependent side, and if there is, that means that they have ascites. And for the fluid wave, you will have the patient lying supine, and with your hands on either side, you can with your hands on either side, you will move their stomach and feel for the fluid wave to hit your other hand. Abnormalities of the abdomen assessment include in the alimentary tract, acute diarrhea, GERD, irritable bowel syndrome, hiatal hernia with esophagitis, duodenal ulcer, Crohn's disease, ulcerative colitis, stomach cancer, diverticular disease, and colon cancer. In the hepatobiliary system, the abnormalities are hepatitis, cirrhosis, primary hepatocellular carcinoma, cholelithiasis, cholecystitis, non-alcoholic fatty liver disease. The pancreas, you can find acute pancreatitis or chronic pancreatitis. The spleen can have spleen lacerations or ruptures. The kidney, you can have acute glomerulonephritis, hydronephrosis, pyelonephritis, renal abscess, renal calculi, and acute renal failure. In infants, you can find intussusception, pyloric stenosis, meconium ileus, biliary atresia, Meckel's diverticulum, and necrotizing enterocolitis. Children may have neuroblastoma, Wilms tumor, Hirschsprung's disease, or hemolytic uremic syndrome. And older adults can have fecal incontinence.